I'm a nurse by profession. The Healthcare Reform Act that was passed, I admit I haven't read all of it, but I'm still confused as to what it's supposed to set out to accomplish. As a physician, can you kind of give us your opinion of, do you think it's, well, I know you kind of touched on it briefly, but do you think there's some room for improvement? And if so, could you tell us what that might be?
I supported it. I'm glad it passed. I believe that it is a right move for the country, so I'll start there. I believe it's right because, for one thing, we're paying for the people who don't have insurance coverage in the dumbest way we possibly could as a country now. And that is, we're asking them to delay care as long as possible and then come into our hospitals and emergency rooms where we shift their costs onto the paying customer. It's a tax. We already pay for it. So the notion that it's an added burden to the country financially is not quite accurate. It's rhetoric. There will be some added cost, but as you know, the Congressional Budget Office, CBO, identified that over a 10-year period as not being significant, not being that high. A lot of people don't like that answer, but they're the best, most objective group. So there's a lot going on the insurance side in that bill that's really important. Coverage, guaranteed issue, all of those sorts of things. Constraints on insurance companies that are long overdue in my mind, and limits on what they can and can't do in underwriting, long overdue in my opinion. There are also a number of things in healthcare delivery that are included in the bill, all of which would be beneficial to patients. They have to be rolled out, but it's the idea of saying, look, Medicare is not going to pay if you don't practice evidence-based care. What the hell have we invested close to $3 trillion in science, development of science since World War II for, if we're not using the evidence that came out of it? If we're denying the science? Don't do that. Not a good way to practice. So there are a lot of things like that. Safety, children's care, women's care, mental health care, and so on. If you look at the bill carefully, there are a whole series of things that are included in there that, if they are properly implemented, and that's obviously a big concern, could have dramatic improvement to the country's health care. If you don't like government in health care, you probably should have gone to another country about 1965 when Medicare was passed. And Medicaid. I mean, Medicare, Medicaid currently account for about 38 to 40% of expenditures in healthcare. That's been going on since the 60s. So this is not socialized medicine all of a sudden. Don't get me wound up about it. I mean, the rhetoric around this is absolutely insane. Now, that said, Obama has done a terrible job of discussing the health reform legislation. He has couched it in terms of getting the insurance companies. And I don't understand why he's doing that. I have friends who are trying to change that conversation at the White House and make it much more about the opportunities to improve quality and safety and access for patients, which is really the cornerstone of this thing. And that is something that American people really feel quite positive about. I just gave a political answer to your question, so I apologize. Thank you for the question. I'd be glad to talk to you over wine, and then we could really get into it, okay?